Hello, and a very warm welcome to this Pharmacology podcast on antiemetics. My name's Ed Wallitt, and during this podcast I hope to give you an overview of all the most important antiemetics and how they work. This is going to be useful both for your exams and in clinical practice as a foundation doctor. So specifically, we're going to look at 5 antiemetics in detail. These are cyclizine, metoclopramide, domperidone, hyoscine, and ondansetron. We're going to look at the dose of each of these drugs, basically how it works and how that relates to the mechanism of nausea and vomiting. We're going to look at indications for each drug and then the adverse profile. So, in order to understand which drug to use in which situation, it's important to have a brief look at how nausea and vomiting works. Now, this is obviously highly simplified, but it's a useful schematic to understand the drugs. So there are basically 3 stimulants for nausea and vomiting. These are visceral stimulation, for example from the gut, stimulation of the CTZ, that's the chemoreceptor trigger zone, for example by drugs, and vestibular input, for example due to disturbances in the inner ear. Now each of these causes specific release of neurotransmitters. For visceral, we've got dopamine and serotonin. For the CTZ, we've also got dopamine and serotonin. And then vestibular input, we've got histamine and acetylcholine. All of these neurotransmitters lead to stimulation of the medullary vomiting center, which causes nausea and vomiting. Therefore, the drugs that we choose can either target histamine, the cholinergic pathway, dopamine, or serotonin. And that's why each of the drugs we're going to consider has a specific one of these actions. Okay, so let's talk about the important drugs. The first one is cyclizine. Now, cyclizine is really commonly prescribed by junior doctors and used as an antiemetic, and it's usually put on the PRN side of the drug chart. It's important, I think, to try and learn drug dosages. Of course, you should always double check in the BNF, but having some idea of what the dose of a drug is really useful when you start practicing, and also given the new prescribing exams, it can really help if you know what the dose is. So cyclizine is given at a dose of 50 milligrams. It can be given IV, IM, or PO, and it's usually given 8 hourly. That's TDS. So how does it work? It's an H1 receptor antagonist. When is it commonly used? So because of its effect on H1, it's very effective in anything to do with vestibular disease, as we might expect from the previous pathway. It's also very commonly used in the setting where there's stimulation of the chemotactic trigger zone. For example, with opioids, which have a side effect of nausea and vomiting, we can give cyclizine and this will partially offset that side effect. We need to be aware of some adverse effects. This group of drugs have fairly profound antimuscarinic side effects, so they can cause drowsiness, they can cause dry mouth, they can cause constipation, and they can cause urinary retention. You're going to see this pattern of side effects a fair amount, so it's useful to memorize each one. Importantly, cyclizine should be avoided in the setting of heart failure or in a patient on monoamine oxidase inhibitors, although to be honest, very few patients are on these nowadays. Okay, let's move on now to metoclopramide. This is another very commonly used drug. Its dose is 10 milligrams. It can be given IV, IM, and PO, up to 8 hourly. That's also TDS. Another one that you might wish to memorize is called domperidone, but you should look up the dose of this. Okay, how does it work? So this one is a dopamine receptor antagonist. Importantly though, it has a prokinetic action on the GI system, so it's going to speed up gastric transit. When should it be used? It's a drug of choice in any disturbance of the GI system causing nausea and vomiting. It's also very effective, just like cyclizine, for treating any nausea and vomiting associated with specific drugs, for example opioids. And it's also an excellent choice in patients who are having migraine, because if you give this with analgesics, it will speed up, because of the prokinetic effect, the absorption rate of those analgesics. Okay, what about side effect profile? So the main thing you need to worry about is extrapyramidal side effects, for example, dystonias with these drugs. Particularly you need to worry about this in patients with Parkinson's disease. It can also cause drowsiness, and because of the inhibitory effect of dopamine on prolactin, it can also increase prolactin levels, but that's really only going to occur in the long term. In terms of contraindications, you should really avoid this drug in patients under the age of 20 years, as there have been a number of case studies of severe psychological disturbance in this group of patients when they're given this drug. Because of its prokinetic effect, you should also avoid this drug in GI obstruction. Okay, what about hyoscine? So hyoscine is given at a dose of 300 micrograms PO. How does it work? It is mainly an antimuscarinic. When is it used? So it's most often used in the setting of motion sickness, and drugs like Quells, for example, a branded drug, which you can buy over the counter, include hyoscine. And usually for motion sickness, you give this an hour before traveling, and then you can take it a number of times during traveling, and it's very effective in preventing motion sickness. It's also often used in patients who are on antipsychotics who are experiencing the side effect of hypersalivation. And if you give hyoscine 300 micrograms 3 times a day, this can partially offset this fairly troublesome side effect. What about the adverse profile? So just like cyclizine, it can cause that whole group of antimuscarinic side effects. And as a result of that, you should really avoid using this drug in anybody who has closed angle glaucoma, and also in patients who have benign prostatic hypertrophy, because in this group of patients, this drug can precipitate urinary retention. Okay, let's move on now to our final antiemetic, and perhaps the most powerful one. This is ondansetron, which is given at a dose of 4 milligrams, PO or IV, 8 hourly or TDS. How does it work? It works on serotonin. It's a 5-HT3 receptor antagonist. When do we use it? So ondansetron is used quite a lot for its powerful effects, but specifically it's used often in the setting of post-operative care. For example, a patient who is given lots of painkillers after an operation, and we want to offset the side effect of nausea or vomiting in this group of patients with a powerful antiemetic. It's also used a lot in chemotherapy, often actually at a much higher dosage, but it's a highly effective drug for nausea and vomiting in chemo. What about side effects? Well, actually, ondansetron has very few side effects, but if you look in the BNF, constipation and headache seem to be the main ones listed. It's also important that you avoid this drug in any patient who's known to have a prolonged QT interval. Because as you know, if you give drugs that further prolong the QT in a patient who already has a prolonged QT, you could precipitate fairly serious arrhythmias. And finally, 2 other drugs which are fairly effective as well, and which you may want to look up after this podcast, are dexamethasone and a newer drug called apripitant, which is a neurokinin blocker. Okay, so in this podcast, we've looked at 5 major antiemetics. We've had a look at the dosage of each, the mechanism, when you might want to use it, and some of the adverse profile. I hope you enjoyed this podcast. See you again soon.